Welcome, listener, to another deep dive. Today, we're unpacking a really fascinating paper from 1985. It's by Avidis Donabedian called The Epidemiology of Quality.
Yeah, and it's not just about, crunching medical stats. It's more about seeing how quality itself is spread out, almost like mapping a pattern.
Yeah.
It really highlights where healthcare quality is strong, but also crucially where things are falling short, and that's across both the providers and the clients, the patients.
Right. So our mission today is to uncover some of those surprising factors, things you might not expect that really influence the quality of care you might receive. And, what that means for actually being well-informed when you navigate the healthcare system. Okay, so let's dig into it. Donabedian's paper, it shows this kind of shocking level of variation in the quality of care people were getting back then. We're talking about big differences in things like how often certain surgeries were performed, or even like the percentage of hysterectomies that maybe weren't justified, very wildly.
Exactly. And what's really interesting, I think, is that he found these questionable practices weren't just random noise. They were often, in his words, highly concentrated or localized.
hmm
So you might have a small group of doctors responsible for a huge chunk of, say, iffy prescriptions or maybe unnecessary operations, which immediately makes you ask, okay, why? Why does it cluster like that?
Yeah.
What's going on in those specific places or with those specific providers? Well, Don Abedian points to some key things about the providers themselves. He found that generally better training, more specialization, even just the number of similar cases a doctor or hospital handles, like in bigger hospitals dealing with high volumes. That often linked up with better technical quality of care.
Okay, but here's where it gets really interesting and maybe a bit counterintuitive. The paper talks about age and experience. You'd naturally think, okay, more experience equals better care, right? But Donna Bedian found that advanced age in doctors was sometimes linked with lower performance. The paper hints this could be due to knowledge obsolescence. What does that really suggest about needing to keep learning, even for very experienced doctors? So doesn't that kind of push against the usual idea that seniority is always best in medicine?
It absolutely does. It's a direct challenge to just assuming years served equals best practice. It strongly suggests that keeping up to date, with the latest medical knowledge and techniques is just critical no matter how long you've been practicing. And it wasn't only about the individual doctor either. The conditions of their practice mattered too. Simple things, maybe, like having the right equipment on hand, or even just seeing patients by appointment rather than walk-in only, those were linked to better care indicators. And if you zoom out, even how care gets paid for, that can shape how doctors practice, sometimes pushing towards maybe doing more tests or procedures, not just the necessary ones.
So it's the whole system, not just the person. What about the hospitals themselves? Did the paper find differences based on the type of hospitals, say, like teaching hospitals?
Yeah, it did. Teaching hospitals generally came out looking better in terms of quality. And the thinking there is often, well, they have stronger organizational structures, maybe better coordination, definitely a culture that emphasizes learning and peer review. But there's another piece, and Donabedian noted it was less studied back then, and that's the client side, the patient.
Right, and what the paper found there is pretty striking, too. Some things you might expect to matter, like patient age or sex, didn't consistently link to the quality of care received. But socioeconomic disadvantage, that often did. Lower status was frequently associated with lower quality care. And here's the real kicker, the really counterintuitive bit. Having more access to care, even with good insurance like Blue Cross back then, didn't always mean better outcomes. Sometimes it actually seemed to lead to an increase in unnecessary procedures, not just the helpful ones. That really challenges the simple idea that more access equals better care, doesn't it? What could be going on there?
It's such a critical point. You'd hope more access automatically leads to better health, right? But Donabedian's findings hint that, well, maybe without the right checks and balances, or perhaps due to how things were financed, easier access could sometimes lead to overtreatment, using services that weren't strictly needed. It really underscores that the quality of care is key, not just how easy it is to get any care. So pulling it all together, what's the takeaway? This whole epidemiology of quality idea shows us that good healthcare isn't simple. It's this complex web. You've got the doctor's training and need for ongoing learning, the hospital's environment, the patient's own circumstances like socioeconomic status, and even how we pay for it all interacting.
It's a really powerful message. It's not just about getting more care, it's about getting the right care, the high-quality care. And this deep dive, looking back at Donna Bedian's work from '85, it really makes it clear that, while things have likely improved since then, that call to try harder and on a wider front is still so relevant. We need to keep pushing for care that's both equitable and high quality for everyone. It certainly makes you think about what good healthcare truly means, beyond just access. Definitely something to mull over until our next deep dive.